Yeah,
He's operating at the moment.
he
So
is
I'm Dr.
operating. Yeah, so we have Dr. Sunandan Basu. I have his profile also. So let me start again because this is
That's
also being
okay.
recorded. Good evening and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Sunandan Basu, all the way from Kolkata. Dr. Basu is a neurosurgeon, a neurologist, and a spine surgeon in Mukandapur in Kolkata, and with experience of over 2 decades. Dr. Basu practices at his own neuroclinic in Mukandapur. He completed his MBBS from the Medical College in 1991, the FRCS Neurosurgery from the Royal College of Surgeons in Ireland School of Medicine in 1998, and the ENS from the European Association of Neurosurgeons in 2008. Some of the services that the doctor offers are decompression, myovascular brain aneurysm surgery, etc., etc. Sorry, doctor, I don't have a full profile with you,
That's
but
okay, don't worry.
this is what I have. And what we have, doctor, going to be speaking about is strokes and neurological concerns for seniors. Dr. Tripathy is not going to be here just now. So we have Dr. Basu. And Dr. Basu, how are things in Kolkata now in terms of the COVID scare, etc.?
It's really gone now. The COVID scare is not so much as the moment. It's the last wave of the Micron it's making more of an endemic now. With more or less everyone is infected at the present moment. In fact, the government regulation also for elective surgery.
Doctor, we can't hear you properly. Can you speak a little louder?
Can you hear me now?
Speak a little louder, yeah.
Okay. What from the latest advisories also, we are not testing in COVID for routine surgeries. But in cases of emergency or in cases of nasal surgeries or patients who are symptomatic, we will be carrying on with the COVID testing at the moment. But the cases are down, so we are hopefully coming back to normal life and gradually building up at the way we have left it to the pre-COVID area, hopefully, but we are not. I think so. The vaccination profile and the vaccination of the patients, that's helped a lot, and people are getting better. We are seeing less and less amount of COVID at the present moment, and the symptomatic COVID is also on the decline. So it's on a good positive term at the moment we are going.
The third wave, for instance, had seen the rise in number of cases in Kolkata as fairly high. Are things better now? Do you see?
Yeah, definitely. Means if you look at the figures coming out from the West Bengal government's thing, it's come down a lot, and it's the symptomatic one and the asymptomatic one. These are the ones which we are taking that it's just getting better and better day by day. So it's going back to normal. We have to get the life normal. If you see the whole of the European states, they are just lifting up all the restrictions. Slowly traveling is being lifting up, and so that's the way to progress at the moment, because we have to get on with our life. We have to be careful, and if we follow the basic thing of washing your hands, wearing your mask, and getting the vaccine, I think so that's the main thing that we will be really doing well.
Right. Thank you, doctor. And let's hope there's no fourth wave that comes in. There was some news about something.
IIT Kanpur has predicted a thing that about. The thing is that there are certain things that it will come and go. Now, if you look at the schools have reopened, so there will be a certain increase of the infection and everything, but we have to get on with life. Our life can't be stopped. And the kids are going jolly well to the school. They are really enjoying the school. And so they're back to the basic normal. We have to go back to the basic normal. It's that one thing COVID has taught all of us. It's back to basic, back to normal. If we can carry on with that, I think so that will be the way to get forward.
Thank you very much, doctor. So the session that we have today, as you're aware, is strokes and neurological concerns for senior citizens. And those of you who have questions can pose them here. Doctor, for a few opening remarks from you on specific things that senior citizens should be looking for in the as far as neurological concerns are concerned.
No,
and stroke specifically.
Yeah, means the thing with the senior citizens, what I say that don't be panicking. The things can happen to anybody. We are not only getting from the thing. Just I want to respond to all the senior citizens who are there, that feel free. This is not one-way talk. I can just interrupt me at any time, ask question. I'm happy to answer at any time. I can be interrupted for all my talks, what I'm giving. That I always tell to the audience and everywhere where I talk, that please, please, please ask question. Then I will be knowing that you're not falling asleep. You are just listening to me and the things. So what the thing regarding the stroke, it's what I say to everybody, whether it be elderly populations or everything. Can you hear me?
Yeah. Sorry, doctor. Can you just increase your volume a little bit?
Volume.
Or is it possible for you to avoid the earphones altogether and just speak directly to the laptop?
It's a desktop.
Oh, it's a desktop.
Just one sec. Just see whether you can hear me. Can you hear me now?
Yeah, but we can't see you, doctor.
Okay. Oh no, that's because no. Can you hear me?
Yes, I can hear you. Hear you better now.
Can you hear me?
Yes, doctor.
I'm just taking this out. Okay.
Great.
The thing is, I was bending my head, so that's why you were seeing my head. The reasons what I said regarding a stroke. What's a stroke? If I say it's a cerebrovascular accident, and what happens to the patients, that there be a variety of things happening to any of the patients. Now, if we look at the comorbidities and the cause for the stroke, if you look at the Indian population we have at the moment, we have a lot of older population that at the age group, at the senior citizen. Way back in the, if you see that one thing, COVID has unfortunately taken us a lot of nearbys of the senior citizen, and it's also increased in the number of the cases of stroke which we have seen in COVID. What oh, thank you very much. Rosie is saying that everyone doctor is loud and clear. Thank you, dear. Thanks a lot. It's the thing that what I say, that it's if we follow some basic principle, it's not that always that we would love to follow the basic principle, because we are human beings at the end of the day and want to behave from the normal. But the thing is, if you look at the aging populations or even the younger populations of the India, it's what we are having is a spot of hypertension and diabetes. If these things can be controlled, and that's the main thing, if you can control the diabetes as well as the hypertension in the young people, and when you're going to the elder age group, these are the things if well controlled. See your doctor. It's not always that you need to see your doctors. You can just check up your blood pressure with instrument which is available, and it only costs 1,000 rupees nowadays. Also with the sugar, what I would say is that go to your, at least have it checked every 3 to 4 months, or have the instrument which you have if you're diabetic to get it regularly checked. Adjust your medications. The other thing which I would say that most of us don't do it is the exercise. If you just go on for your walk, exercise every day, what means most of the people that come to me that they're having back pain and leg, and after the stroke that they're not being able to walk, what I say to them is just simple walking. Don't have to do overstrain yourself with an hour. Even a 10 to 15 minutes every day in the morning, and 10 to 15 minutes a day, and maintain your diet. I would say that you don't have to be a substance that I won't eat this thing, I won't eat. No, if you eat, yeah, everyone would love to go and have some types of food or extra. Yeah, you are allowed that once or twice a week, but not every day. So if we can just control ourselves with a certain things of exercise, diet, that would be the way that we should be going forward.
Thank you, doctor. Volume levels are still a little low, if you can, but that's okay. Doctor, we have a question from Mr. Debendu Ganguly. He says he's 60 years old, male. Are people who have had a head injury in their 30s more prone to stroke in later life?
No, absolutely no. Head injury does not have anything to do with stroke. It's the thing is that it depends upon what type of head injury also. See, if you are having a head injury when you're younger, whether it's a severe head injury or a mild head injury, we don't know is the answer. But with the thing is that, but it does not predispose us to stroke. What I would think is more predisposes to stroke is your habit of alcohol and cigarette. If you are taking alcohol every day, if you are smoking cigarette, that's the one which predisposes. If you're taking the tobacco, that's the one which predisposes to your stroke. So cigarette, tobacco is one of the most commonest thing for the stroke. Regarding alcohol, taking optimal amount once a week is fine. I don't prevent any of my patients to have them, saying that no, they can have them, and that will really help them also.
Thank you. We have a question from Kumar K, who says, one morning when I was on a regular morning walk, there was a call. My friend informed about the birth of a child. I respond saying congratulations, but I couldn't complete. My speech was not clearly coming. I rushed to the doctor and found that the BP was abnormally high, and I was advised to go in for a scan, etc. I was told that if I had delayed, I could have ended up in a stroke.
Yeah, that's what I said, that the thing is that we need to control our blood pressure. It's the commonest cause. If you look at the Indian population in the present moment, the commonest cause of stroke is hypertension. And we unfortunately are getting at the age of 30, 35. That is the thing, that the pressures are going up and they are having stroke. They are leading a life which is totally not to the normal benefit of the patients, and they are just having to go around. The thing is a normal lifestyle and everything of going on without doing exercise, long walking hour, then going on for heavy drinking, binge sessions, smoking, and all these things without any exercise. So if you carry on these, this is one thing. For you, unfortunately, that you have been in the right place at the right time, that you were having problem with your speech, and the thing is that we have called this as a TIA or transient ischemic attack, and it was detected, and you were also hypertensive at that moment. And it was very nice that that could be detected, that the hypertension was detected, and straight away that we could control your blood pressure, and that helped us a lot. I think so. Controlling your blood pressure and sugar would control 90% of the stroke in all the people.
Right. And how often would you advise, doctor, that somebody over the age of 60 should be checking their blood pressure?
With regards to the pressure, if it could be just once a week should be enough. And regarding at least once a week, you should be checking it if you are on a regular, but hypertensive. And you should, and what I said before also, that the blood pressure instrument at the moment just caused that there is only cost you about 1,000 rupees, the thing. So the thing, it's the blood pressure instrument, the electronic one, it's very easy. Anyone can use it. I can use it. You can use it. Any young kid can use it. And once you just measure it, just relaxing in a way, and once a week is enough, but in a relaxing situation rather than in a stressful situation, what I advise.
Thank you. Doctor, there's a question from an anonymous attendee, a lady, 77, who's had a stroke 7 years back due to bradycardia, has pacemaker, still has movement issues. What can she do to improve mobility and also overcome her speech difficulty?
Whether, I don't know whether she's a right-handed. It's likely to be a right-handed person who, when they have a stroke, and what you're saying is that she's got a pacemaker also. A right-handed person having a stroke, that would be with a right-sided weakness and a speech problem, because most of us, 90%, are with the left hand side of the brain, which is the dominant hemisphere. That's we call, because that's controlling our opposite side, that is the right hand side, and also a speech control.
If we just responded saying right side.
Yeah, and the right side. So that is the reason that left-sided stroke was the cause. And what she needs to do at the moment is down the line 7 years. So she should carry on with the exercises which she had been shown, and she should be out and up walking as much as possible. Regarding the speech, yes, speech therapy is there. And what I would say is also controlling how, means what I can see is a lovely collection of books behind you. And that's what I would ask everybody to do. Read the books. Means I would enjoy, if I go down to the evening and then at house, most of the days I would be just with a cup of tea and everything, go around with the books rather than going down to a club and having a beer. I would prefer this, that we watch the TV with the friends and family. We have a chat with ourselves. The main problem what we are having more with the stroke patients in the India is we are slowly turning into a society where the elderly are being left alone, being to fend alone. The younger generation is moving out. Maybe that we were previously into a joint family and everything. This is now gone into a more of a single oriented family where there are only the parents with with the kids, and that's what's affecting the elderly populations who are there. Means if you look at the West Bengal or look at it, the major metro cities, half of them, the elderly populations are alone in a gated community with support from the family is bare minimum or sometimes, and that's what causing them that they're to go into depression, not going into exercise and something. And these are the one which causes the problem, I think so.
Doctor, in your experience, because you've been through your neurological practice for a few decades, do you think the number of cases has gone up in the recent past, or is it the same?
No, it's really means COVID has, during the COVID period, if you see
yeah, even before the COVID period, what was it?
Yeah, there was a steady increase. It's not decreasing, and definitely the younger generations are getting affected more and more. But the older generation above 60 is also getting affected, and with the elder generations. But some of the elder generations are really going good, who maintain the basic lifestyle, exercise, walking, staying with the family, staying, talking, reading. It's a good habits. That's basically if they are practicing. Well, someone, if you say that, then some people also say I'm doing the same thing. I'm 80 years old. I would still love my whiskey every night. You can't stop them. And a cigar. So I never stop them, but I say that, yeah, you have lived your life. You can enjoy it. There is nothing we can do.
Right. Thank you. We have a question from Mr. K.V. Brahmanand Rao, who says, "Dear doctor, I'm 72 and a diabetic for the last 25 years. These days I'm experiencing in nights a numbness, particularly on my left palm and my left foot."
Diabetes. The other thing, what I say, that the diabetes is the one which causes the stroke and everything. But with diabetes, if it's well controlled and if your sugar level is okay, that really helps. This what we basically, since it's a diabetic patient, there will be some numbness and pins and needles going down your hand, and we refer to this as diabetic neuropathy. They developed after long term of diabetes after 5 or 10 years. And the ideal thing on this thing, what I would prefer for them is to go on and just a simple medications of B1, B12, B6. And that's a methylcobalamin or a multivitamin if you get. There are plenty of multivitamin in India where you can get from 1,000 rupees to 1 rupee to 2 rupees. But if you look at the plain simple multivitamins, other foods which are rich, the green leafy vegetables, what I say, an apple a day keeps the doctor away. These, an orange and banana and the fruits, coconut. The coconut is water, simple. That's very high in potassium. And if the people come a lot of with coconut, that we are buying medications to increase the coconut. Have a coconut to increase the potassium. Have a coconut. That would be really good for the patients, rather than it would help the people rather than buying the medications. My simple belief is that the more you go on to the basic simple thing of doing the stuff with your basic lifestyle, I think so we can avoid 90% of the medications.
Thank you. Well, this is a question which is not exactly on neurological thing, but I guess since you are there in the house, Aban Dondi asks, is BP medication to be taken all one's life, or can it be stopped when it is normal?
No, it means the thing is that it has to be taken all throughout your life, but it's not 100% that you have to take it all throughout life. If your blood pressure is controlled, and if your doctor sees that your blood pressure is controlled and you're not taking the medications, and the etiology of the bad blood factors have been because of your overweight or your dietary habits or your lifestyle activities, and that's what's controlled it, I think so it can be stopped. But at the end of the day, it's the doctor who's looking at you. That should be the one person who would be controlling that, whether you should stop it or whether you should stop it or whether you should continue with the medication. That's my advice to everybody.
Dr. Basu, there's another question from Mr. Dinesh Babel. He says, for the last 50 to 55 days, I'm facing a problem of tingling. In Hindi, it's called jhanjanahat in the feet, palm, ankle, mainly when I keep on walking. I took both types of treatment, Ayurveda and allopathy, but not even 2% improvement. Finally, I was told to have Panchakarma Kriya, which I will start around March 10th, subject to learning from your webinar.
See, the thing is, the commonest cause, I again say that it's not because of the stroke, but there it could be due to because of your problem in the spine, which could be in the neck or in the back. And that's the thing is that what I would advise them to see a doctor before starting all these things. If clinically you are okay, you can go for whatever treatment you want. See, the Ayurveda has been there, all this sort of treatment still has been there for a long time. But what I advise is visit a doctor, get a clinically assessed, see whether you need an MRI or an NCV or certain test, and then go for all this investigations and go for all this Ayurveda treatment. But my advice to you is that always please be kind enough to visit a doctor first and then go off for everything.
Right. Thank you. We have a question from Mrs. Sharda, who's in Chennai, and she is 63 and diabetic since 12 years. I have a severe pulling sensation on my toe, that is the big toe on my left leg, and pulling sensation in my finger next to my toe, that is of my right leg. Can you please help? What should I do to avoid, as sometimes it is very severe?
Okay, my advice to you first is always go and see a doctor. The other thing is to do exercise. Be on the cautious of what sort of exercise you can do. You should go to a proper person who does the exercise, do the yoga, but it should be a proper person. The other thing is that God has given us something very free to all of us, which in India we have plentiful. But unfortunately, India, in spite of having free sunlight, no one wants to go out in the sunlight. Instead of that, we are buying vitamin D3. We should not be buying vitamin D3. We should go out in the sun at least 10 to 15 minutes a day. That's my advice to everybody. Burn yourself. You need the sunlight. The sunlight has two things. Number one, the vitamin D, and the other one is the happy hormone melatonin. Once you get the sunlight and the melatonin above all, you would be in a very, very good position. See, the half of your symptoms would be gone, what you were saying. And I think so you should be going out in the sun. Use any oil if you want to, but at least you should be going out for at least 10 to 15 minutes every day, because that will help in with your longevity. It will help in your prevention of stroke, and it will help in your exercise as well, the other things.
10 to 15 minutes walk in the sun. Is any time that you would prefer, or you recommend morning or evening?
It's morning would be better, because in the evening or in the middays, everything, because at the moment there will be a problem with the sunlight and everything, because in the midday it could be stroke and everything. So my advice to you, everyone, would be that it would be a sunlight in the day, in the early hours of the morning. That's the best thing. And if I can't show you my hand, but if you look at my hand over here, and if you look at over here, sorry, whether you can see it, you can see a stark contrast, because the moment I get out, the moment I think, but the moment you get out in the sun, that will gives you a feel-good factor. Because a lot of people, if you see also, that the stroke and everything which occurs, and any problem, that they go into depression also. If you don't have the sunlight, which was found that in the Europe, that when the winter comes, the sun goes out at 3 o'clock in the afternoon. And then what happens is that people go into depression and they suffer from stroke. So this is, I think, diurnal variety. So these are the one which we should be avoiding, that we should be going out in the sunlight. We should be there taking a daily dose of sunlight. If it's not there, fine, you can do it. Vitamin D3 is a good supplement, but I tend not to use it until it's absolutely indicated. So these are the things which we have to take into consideration.
Thank you, Doctor. Doctor, many questions have come in. I'm going to, go to them one by one.
I'll answer all of them.
There's Meenal Bajaj, who says she's 65. Here, my palms past few days have swollen and have tingling all over. Sometime instead of taking vitamin B12 and BP daily, she is written in SMSEs, so I'm not able to understand. But she has some swelling on her palms and tingling all over. Sometime instead of taking vitamin D, B12 and BP tablet daily?
Well, what I could is that the commonest thing is that your blood pressure needs to be controlled. You need to take your multivitamins. You can take it. I don't mind. But what regarding your blood pressure, the thing is that what you would be doing is that the blood pressure should be regularly checked, at least when you're having the symptom. The other common symptoms, what we get in a female above the age of 45 is carpal tunnel syndrome. That is, there is a nerve which is the carpal tunnel, the median nerve which gets compressed, and that what causes your tingling and numbness in the hands, which is very common. And you wake up in the middle of the night with the features of just you have to shake your hands as if your whole hand is numb. So this is very common in the female age group. And if you are there, just wear a splint. That would be really good, what we call a carpal tunnel splint. But however, you should always go and see a doctors to see whether the nerve is compressed or not.
Thank you. We have Mr. S.C. Jain, who's 80 and says he does not have diabetes, and BP ensures that, does that ensure that 90% of the people will be spared of a stroke if a person doesn't have diabetes and BP?
Yeah, means the thing is that it's not 90 means, but the thing is the hypertension and diabetes is the commonest precursors of stroke. But and also the other thing is the familial thing has to be played. Again, a stroke is of different kind. Stroke could be due to the cutoff of the blood supply. It could be due to the blood supply being excessive, causing a bleed in the head. So there are certain things which are there. So, but if we maintain a happy life, and in this way, Mr. Jain, I think so, he's leading a really good life and everything. Now he should be really one of the role models of what he is doing, and we should be following him, hang up on what's going on. But I think so what he has pointed out, the hypertension and diabetes, smoking, alcohol, these are the one things, tobacco, which causes stroke.
Thank you. We have a question from Kumar K. What is the optimum level of BP for a 65 plus person who's diabetic and having liver cirrhosis? Do we need to worry when the BP is low?
No, it doesn't matter whether the BP is low, but if it's high, then I would really look into it. I would always consider the cardiologists have been looking after that. Any blood pressure above 130 or 140 and the lower one above 90, 80, above 85, that's the thing. It varies from person to person. It's how your body and the thing and your structure. The Cardiological Society and from India also comes out with a guideline. So if anybody is having a persistent rise of pressure above the 140 and this one above 85, so I think so he should be looking at the doctor. He or she should go to the doctor straight away.
Right. We have a question from Mr. Kunjvihari Telokekar. He says, I'm 84, no smoking for the last 56 years. A glass of wine once a week or occasional whiskey, vodka, one in a month or two.
I would join you, definitely. Please invite me.
Had CABG 12 years back. BP and sugar are within limits, but I get dizzy if I get up from a chair and move quickly. Haven't been doing exercise for the last 2 years due to COVID and lower back trouble. Since the last 10 days, I've been getting some sort of shivers starting from just over the knees of both the legs, going down to below the knees. The GP felt it's a myoclonic jerks and has stopped Pregabid NT that I was taking for backache. Any suggestions?
Means my thing is that, see, the COVID has turned us a lot of things, that we have lost a lot of patients and we have stopped doing a lot of things. My advice to you is that carry on with the exercise. Nothing will happen. What I do for these persons, what I say is that don't start on day one for doing 1 hour exercise. Start off with 5 minutes, just walk for 5 minutes and see how you're going. Then increase it to 10 minutes and then see how you are doing. And then gradually increase it to 15 minutes, 20 minutes. So if you overdo on day one, that's the end of it. So my advice to you all is that always be on the alert, always on the go, just be right and see that how you're going, and start off with a very mild exercise, slowly increasing it. Don't overdo itself. It's like Mr. Shane wants. Means we all love Shane Warne. But what we have slowly, we have gotten from that Shane was going on with the keto diet and he was exercising very hard. And that's what the precursors of for your, if you start off with very hard things and straight off, it's going to affect your body. So you have to be very careful.
Great. So that's, I guess, the message. Don't do anything in extremes. We have a question from Deepa Ved, who is 67, met with a mild brain stroke on Jan 13th, 2022. She's fine now, but would like to have your advice regarding her food. Any supplement and what else should be done? My left palm finger trembles. I feel weak on my left hand. And BP is somewhere between 140/81 and pre-diabetic.
Okay, my advice to you is start on with your exercise. Please see your doctors at that moment. You had a minor stroke. It can be easily be. Thing is that once you exercise, go out for walks, enjoy your life rather than saying that, oh, I had a stroke. And the thing, no, it's have to be taken out in a positive way. Take your medication, be on a healthy diet. You're going to. Regarding the food, I don't forbid anybody to have whatever the food, whatever they want. But it's the thing, if you take it on excessive, it's going to affect you. Best is to be on a healthy diet, but you can, of course, on a Saturday, Sunday, everyone wants to have some extra food. Yeah, you're allowed for that. But the other thing is that you should exercise, and that should be the way it should go forward.
Right. Doctor, we have a question from an anonymous attendee who asked, what causes restless legs? Can anything help to have a good night's sleep? Is this a nerve problem?
Yeah, restless leg syndrome, it's mainly people with tension and anxiety. That's the one which they cause. And this is what I would say, that tension, anxiety is the commonest cause of restless leg syndrome. But again, on the other hand, what I would say is that we should also be very careful in what we are doing and not doing. But my thing is that exercise, swimming would be one of the best exercise if you can do it. Even walking in the water, that's what my advice, that walking in the water, exercise, swimming is one of them. And for rest, like there are a lot of medications available in the market. I'm not going to name any one of them. My advice is go to your doctor, ask them, they will definitely give you medication and which works run wonderfully well.
Right. Doctor, there's somebody who's asked about, are you available for teleconsults if somebody wants your advice?
Definitely, the hospital has a number. You can contact the hospital and they will, I regularly am on the thing doing teleconsultations with everybody through the hospital. I practice only in this hospital. I don't go out much. That's the thing is I'm full-time. I come up at 8 o'clock in the morning, out in the evening. So that's how the healthy lifestyle I try to maintain, but half of the time I don't maintain, although I advise to everybody.
How do you maintain your good health? Because obviously there's a fair amount of stress that you have as a doctor.
There is a fair amount of stress with the surgery and everything what we are doing, again with the patient's family, dealing with them, very sick patients, and least but not the least, don't mind anybody. If any one of you are lawyers, they are after us all the time, that even if you don't do a mistake, they will make it up that yes, there is a thing that you have done a mistake, even if you don't do it. So these are the things you have to deal with in life, whether you stay anywhere in the world. So it's just exercise, reading books, listening to music. These are the one thing, watching movies, and these are the one thing which really helps you out through.
Great. Thank you. We have a few more questions which I'll just take. One is, person says, I'm a diabetic and under my feet a lot of cracks have developed and causing severe pain and a burning sensation. Is this a neurological issue or is this a skin issue?
Yeah, no, it's a neurological issue, and what's your diabetes needs to be controlled. And regarding the cracks, what I say that you should consult a doctor, and if you see that if you put your put your leg in a warm water, or you apply Vaseline or anything, is the thing is that their patients will be really helpful, will be getting the benefit. But the thing is, other what I've said, that the vitamin B12, B1, B12, B6, these are the things really help. And there is some medications which are coming into the market now, pregabalin and gabapentin. These are really control the symptoms of the patients. But please get advice from your doctor, and then only you will be having to it.
Right. Thank you. Uh, I have a question from Mr. Verma. Says my wife 70 has been experiencing circular sensation in the thighs, and this sensation keeps moving downwards. It seems something to do with the nervous system. Any treatment?
Yeah, that's the thing. What I say is exercise physiotherapy.
Doctor, we can't hear you at all. Can you speak a little louder?
Can you hear me now?
Yes, I can hear you now. Yeah.
What I would say is that the exercise, physiotherapy, sunlight, these are the main things. But we, your doctors at the moment, go and visit your doctors, get a thing. But the thing is, this is a peripherally that there is some muscles being affected, the nerve roots are affected. So my advice to you is just get on with your exercise, get on walking, see your doctors, get out in the sunlight, and if needed, use vitamin D3 and B1, B12, B6. That would be the one which will really helps.
Right. Thank you. There's a question from Mr. Trilokinath Dubey. Says out of the two reasons, blockage and hemorrhage, what is the difference in the symptoms of both?
See, the symptoms will be the same more or less. See, when the blockage is there, there is that the blood supply to that area of the brain is gone. Whereas in cases of a hemorrhage, there is an excessive hemorrhage to the brain. There is a hemorrhage to the area of that brain. It depends upon which part of the brain is affected. If you look at the simple human being, if you look at the front, we call this the frontal lobe. And if any one of this, the left side is more than the right, the left side is more for personality and for memory. The right side is also for personality, but the left is more. If you're looking at the temporal lobe on the thing, on the left-hand side, it is for your speech, which is there. Then in the occipital lobe, that is for your vision, but also the temporal fibers have got some vision things. And if you go, the muscle fibers, which are going in from the prefrontal and the frontal, this is from the basal ganglia area. So these are the ones which we have to take. It's depending upon which exact site of the brain is affected. We have to look into that.
Great. Thank you, doctor. One last question.
I can take, no problem.
Which is from Mr. Nimish Shah. Says, I had frequent cramps in my left legs while gym workout. Is it possible that I get a stroke in the future?
No. The thing is, if you're gymming and if you're getting cramps in your leg, the simple thing is that you need to rehydrate yourself. You need more salt in your body. And this is what I would, all the thing is that if you just go on and check your sodium, potassium and everything, the thing would be able to control and the things. So my advice to that, those who are gymming, please hydrate yourself. In a day, we should be at least drinking 2.5 to 3 liters of water. See that we are having adequate amount of sodium and potassium supplements of the food, and that will help everything.
Right. Doctor, one more question which has come in. There are quite a few questions about people who have had COVID, and
We'll answer them.
There are some fears on that. So, is there any, overarching kind of that advice that you can give to people who have had COVID, who are seniors, and what they should be careful about?
Yeah, the thing is, first of all, what I would do, all the COVID said, please, it's just, I'm begging your hands that please go and take your vaccine. We should all be getting the vaccine at the thing that we should get the third dose also, because vaccine is one thing has proven to everyone that the amount of comorbidity and the thing which is associated with COVID infection, it's really coming down. The number of things have come down. So we just have to be very careful on what we are doing. So best thing for us is to get the vaccine and do the simple things. Wear a mask, wash your hands. That's all I would say. Go back to your normal life and everything. You will be okay.
Thank you very much, Dr. Sunandan Basu, for joining us in this session of Health Live at Seniors today. We've answered approximately 20 odd questions from people here on a wide range of issues, and you've answered them all very patiently. Thank you very much for being here. for being here and addressing the queries of all our readers who are here. To those of you who are present here, we will be back once again next Saturday at 5 p.m. for a session of Health Live at Seniors Today. In the chat window, we are also putting up a link which you can use if you would like to register for all our forthcoming sessions. So you don't have to register every time, and we will pre-register you for all the forthcoming sessions that are there. Thank you very much once again, Dr. Basu, for joining us and answering the questions of all our people here. Thank you very much.
It was really a pleasure talking to you all. I'm happy to join you again. Definitely given a chance. Saturday at this time, I would love to see you all again.
Great. Thank you very much, Doctor. Thank you.
Thanks.